Hi, we're going to talk about the use of cannabis for fibromyalgia. This is a syndrome. So we're talking about managing several symptoms, if not all of the above, including fatigue, poor sleep, irritable bowel, muscle aches and pains, mood disorders like depression or anxiety. All of those can be included in a typical fibromyalgia syndrome. Turns out that all of these are functions that our own endocannabinoid system is supposed to manage. So it immediately comes to mind that maybe fibromyalgia is a disorder of the internal endocannabinoid system. And that's been proposed as a hypothesis, that it's an endocannabinoid deficiency syndrome. Based on that theory, we would definitely want to throw quite a lot of THC into the mix because THC is the cannabinoid that binds to our own endocannabinoid system and stimulates it. CBD does not do that. So we would want to start by getting at least 5 milligrams of THC into your system 3 times a day. During the day, you're going to want to use a sativa, which is stimulating and would help depression. And at night, you're going to want to use an indica, which is sedating and which will help with sleep. And of course, you'll increase your dose from there depending upon your pain level and your symptomatic level and what other medications you're on. But you might have to go up to 15 or 20 milligrams of THC 3 times a day to manage fibromyalgia. That's a high dose. Hopefully you won't have to go that high because then you'll be dealing with tolerance issues. For those patients that also have anxiety and that can't tolerate the psychoactivity, then you're going to want to bring some CBD into your mix. And the typical strategy is to shoot for a 1-to-1 mix. So 5 milligrams of THC plus 5 milligrams of CBD 3 times a day. And you go from there. That might be sufficient. So that's another way to approach it. And last but not least, some people with fibromyalgia do use topicals, especially on their trigger points, which are points in the body that give them specifically increased pain. Because it might be an endocannabinoid deficiency syndrome, the use of cannabis for fibromyalgia holds a lot of promise for actually reducing the impact of the disease and possibly reversing it. And there are some studies that show that this might be the case.